Another day, another story. Fibroid complications. Fibroids can cause a range of complications, depending on their size, location, and number. Some of the potential complications associated with fibroids include heavy or prolonged menstrual bleeding. Fibroids can cause heavy or prolonged periods, which can lead to anemia and fatigue. Pelvic pain or pressure. Large fibroids can cause pressure or pain in the pelvic region. Urinary problems. Fibroids that press against the bladder can cause urinary frequency, urgency, or incontinence. Bowel problems. Fibroids that press against the rectum can cause constipation or other bowel problems. Infertility. In some cases, fibroids can interfere with fertility by blocking the fallopian tubes or disrupting the normal structure of the uterus. Miscarriage. Fibroids that grow inside the uterus, known as submucosal fibroids, can interfere with the implantation of a fertilized egg and increase the risk of miscarriage. Preterm labor. Large fibroids can cause the uterus to contract prematurely, leading to preterm labor and delivery. C-section delivery. Fibroids that grow near the cervix or in the lower part of the uterus can obstruct the birth canal and require a C-section delivery. Placental problems. Fibroids can interfere with the development and attachment of the placenta, which can lead to complications during pregnancy. Treatment options for fibroids vary depending on the individual case. Fibroid and fertility. Fibroids can affect fertility in some women, but the extent to which they affect fertility depends on the size, location, and number of fibroids. In some cases, fibroids may not affect fertility at all. But not all women with fibroids will have complications during pregnancy. The size, location, and number of fibroids can all impact how they affect pregnancy. Fibroids that grow inside the uterus, known as submucosal fibroids, are the most likely to cause fertility problems. These fibroids can interfere with the implantation of a fertilized egg and can cause miscarriage or premature labor. Fibroids that grow in other parts of the uterus, such as intramural or subserosal fibroids, may also affect fertility if they are large enough to cause distortion of the uterus or block the fallopian tubes. In addition, large fibroids can cause pressure on the bladder or rectum, which can lead to discomfort or pain during sex. Treatment options for fibroids and fertility depend on the size and location of the fibroids, as well as a woman's age and desire for future pregnancies. Some treatment options include myomectomy. This surgical procedure involves the removal of fibroids while leaving the uterus intact, and is often recommended for women who wish to conceive in the future. Hysteroscopic myomectomy. This is a less invasive procedure to remove submucosal fibroids through the cervix. Uterine artery embolization. This procedure cuts off the blood supply to the fibroids, causing them to shrink and die off. It is not typically recommended for women who wish to become pregnant in the future. In vitro fertilization, IVF. Women with fibroids may be candidates for IVF, which involves fertilizing an egg outside the body and then transferring it to the uterus. It's important for women with fibroids who are concerned about their fertility to discuss their options with their healthcare provider to determine the best course of action for their specific case.